Good morning, guys. We're going to go over a case study today, and the purpose of this is to highlight the complexities involved in making the diagnosis of testosterone deficiency. Now, as we're all aware, there are BSSM guidelines, so British Society of Sexual Medicine guidelines, that help clinicians in making a formal diagnosis. Now, obviously, it includes a thorough history, examination, and investigations. You should have a thorough complement of diagnostic bloods to look for causation, to look for reversible causes, and to exclude contraindications and possible cautions. You also need a second confirmatory blood test to make sure the first one was not erroneous. So say you had intercurrent illness or something was lowering your testosterone and it wasn't a true reflection of your long-term testosterone, it needs to be confirmed. Because testosterone levels do fluctuate. Now, we know they fluctuate on a diurnal basis, so anabolic processes predominate at night time, so your testosterone level is highest in the morning. We measure levels in the morning because we want the levels to be at their highest. But I'm trying to get a diagnosis of low testosterone. No, you do not want a diagnosis of low testosterone unless you have a diagnosis of low testosterone. Why? It's complicated, but in essence, TRT is a complicated therapy that is very involved. So the decision to start somebody on testosterone replacement therapy should not be flippant. And I'm going to say this, having diagnostic bloods that confirm you are a candidate is not enough to make the diagnosis. Oh, well, yes, sometimes I'm a bit tired. Everybody's a bit tired sometimes. I've got low libido. Everybody gets low libido sometimes. Stress, intercurrent illness. There are lots of factors that contribute to these symptoms that are troublesome, but you need to look for causation. And a lot of guys have been on the internet, they've tapped in their symptoms, and the computer says low testosterone. They've had their diagnostic blood work, and it says low testosterone. So I now qualify for low testosterone. You want to go on to TRT if it is in your best interests. Now, it's no secret that testosterone can make you feel great, but do not go on testosterone replacement therapy unless you need it, because it doesn't matter how good your TRT protocol is, it is not as good as Mother Nature. And I'm going to give you an example of why it's not as good as Mother Nature, because when we start somebody on testosterone replacement therapy, the aim is obviously to reverse the negative symptoms associated with low testosterone. One of the other aims is to make sure that all the other physiological parameters that can be affected by testosterone stay within normal physiological ranges and hopefully are optimized. Because as we know, all hormones are dependent. Whether it be a direct or indirect relationship, there is an association. And again, everything contributes to everything. Nutrition, lifestyle, exercise, all of these factors influence your state of well-being. So, one of my guys brought his son to see me. Obviously, the guy is a patient of mine and super happy. So he appreciates the importance of normal testosterone levels in physical and psychological well-being. Now, lots of people want to screen their testosterone levels to know where they were when they felt their best. Now again, feeling your best involves an awful lot of factors, but testosterone is an integral component to that. So again, the reason for testosterone is to help facilitate growth and repair, to help facilitate anabolic processes, and conversely to match the catabolic processes. It's to repair the damage done in the day, to prepare you for the day ahead. Fight and fornicate. I love that. Wham bam, thank you ma'am. I'm getting some new catchphrases. Grooving with the eternal now. So yeah, it would be useful to have a reference point. And what this example is going to highlight is the complexities of using reference ranges in making the diagnosis of low testosterone. Because as we know, a reference range is a 95% confidence interval. That means 95% of the population will fall in that interval. And we also know that testosterone levels drop with age. So conversely, you would say, and quite logically, the younger you are, the higher your level should be compared to the other range. So it makes sense. I want to be high normal looking at a reference range. But is that high normal best for me? Now, we've already discussed the fact that reference ranges reflect average, not necessarily normal, because we live in a sick society. So what should you do? Well, this guy has brought his son in because obviously at 19 years old, he's fighting fit. He's actually a high-level rugby player and super happy, super everything. So he wants a reference point from when he was at his best. Now let's remember, testosterone is a fundamental hormone for well-being. And obviously, the higher the number, the more alpha you are. So get ready for this guy, this 19-year-old rugby player, his numbers, early morning numbers. Total testosterone, 16.5. Free testosterone, 0.396. Estrogen, 90. SHBG, 27. So a lot of people would quite rightly and reasonably say pretty rubbish numbers. I mean, they're within range, so he wouldn't qualify for TRT according to the BSSM guidelines. But I would also say I wouldn't want those numbers. But I'd be wrong in saying that those numbers are not optimal for him. So all of the other physiological parameters that we measured were perfect. He had his in-body 770 score, where we measured his lean muscle mass, visceral fat, etc. All normal. This guy is an alpha 19-year-old rugby player. He hadn't overexerted himself. So these numbers were his optimal numbers. How can they be optimal? 16.5, free T, 0.369. How? It's crazy, isn't it? So I've discussed this before in a previous video log. Another guy with very similar numbers, but a much older guy, completely asymptomatic, came to see me on the recommendation of another patient, and we decided not to start him on TRT. But this 19-year-old didn't obviously come for TRT. He just came for a reference point for how he was feeling right now, which was brilliant. So this highlights the complexities involved and the fact that you need to treat the individual sat right in front of you and make a decision as to whether TRT is in somebody's best interests, having taken a thorough history, performed a physical examination, performed appropriate blood tests, diagnostic blood tests. But as you can see from this example, there are complexities involved. So I would urge caution to people looking for, number one, a magic bullet, because say you present with low libido and you have a testosterone level test and it comes back borderline, so 3T 0.369, well, it's got to be that, hasn't it? From this example, you can see that that's not necessarily the case. So we need to approach medicine from a holistic perspective. Now, one of the major flaws in the current medical model is the specialization of medicine. That seems like a stupid comment, because surely the more specialized we are in a subject, the more efficient and effective we are. Yes and no, because you are not looking at the whole picture. You're not looking at the patient as a whole and appreciating the fact that other processes, organs, systems interact, influence the narrow scope of field that you're looking at. So one of the sad things about modern medicine is the lack of generalism, because you must approach the patient and look at every aspect. So when you decide if TRT is in somebody's best interests, it 100% should not be via a 5-minute cursory phone call and diagnostic bloods. You must look at the person as a whole, weigh up the pros, weigh up the cons, and always act in the patient's best interests. This is not a sales-consumer relationship. This is a doctor-patient relationship.